And it looks like we have slowed down on people joining, so we'll go ahead and get started. I'm Allison Linville, I'm the Executive Director of Marketing and Communications at Flathead Valley Community College, and I'm moderating our panel today on registered nursing. So we will get started. I'll just ask each panelist to tell us a little bit about themselves, a quick introduction, before we get started with some questions that came out of a high school student survey. So those should be pretty applicable. So we'll start with you, Myrna. Do you want to tell us a little about yourself?
Sure. I'm Myrna Ridenauer. I'm the current director of the nursing program at FPCC, and I've been a nurse for over 40 years, and I have a master's degree in nursing education and leadership.
Great, thank you. And Ryan, do you want to go next?
Sure. My name is Ryan Pitts. Lived here in the Valley since I was 12 in 1988. Graduated from Flathead High School. Later in my career, I went back to school to become a nurse at Flathead Valley Community College, where Myrna was the program director and guided me through that process. I currently work at the hospital as a chief nursing officer for Kalispell Regional Medical Center.
Great, thank you. And Jesse, do you want to go next?
Yeah, hi, I'm Jesse. I'm a native to Montana, grew up there just north of here in Eureka, moved to the Valley to start going to nursing school. Completed my nursing program through Montana State, and then I met Myrna. She was the clinical nurse educator here at the hospital as when I came on board as a new resident about 11 years ago. So from then on, I've been working here in oncology mostly for the last few years, and I'm currently the supervisor of PRMC's inpatient or outpatient infusion area and the vascular access team.
Great, thank you. So I'll just go through the questions, and everyone doesn't have to answer every single one, but you guys can feel free to jump in and tag on to other people's answers as much as you want. And if you don't answer it, then you can just stay on mute and we'll go on to the next question. So our most popular question that I think is pretty fun is, what is the craziest thing to happen to you or that you experienced on the job during training or in your career?
So my craziest thing was when I worked in a small rural hospital in Red Lodge, Montana. And when you were the nurse there, you did everything. And one day a gentleman came in who had had a snake bite. And the doctor asked him if he knew for sure what kind of snake it was. And he says, well, just a minute, let me get my buddy to go out and get the snake out of the car. And they brought it in. We all thought the snake was dead, of course, but it wasn't. It was still alive, and it was a rattlesnake.
That's pretty wild. Ryan or Jesse?
I could jump in here. I've spent most of my career in the emergency department, so a lot of different things, but I think wild and crazy is times when we really don't expect maybe someone to survive the event that they're going through, and I've definitely seen some miraculous people pull through and have people walk out of the hospital that we really didn't think were going to.
Wow.
For me, I guess it wasn't wild and crazy, but like just kind of one of the more intense things of being an oncology nurse has been kind of being part of the people as they kind of come to the end of their life and being part of supporting them and their family. It's an intense time, but you also feel really honored to get to be a part of that process with people. It's taught me a lot about just life and death in general for myself. So that's kind of been that for me. I think that's what stands out anyways.
Yeah, that's interesting. That's something to hear a lot of nurses say, that it's an honor to be part of people's lives in that way. I think that's really neat. So our next question is, tell us a little bit about what an average day of work is like for you. I know that question is probably challenging in nursing, but you could sum it all up. How would you describe what you usually do on a day-to-day basis, just briefly? You want to go the other way? Jesse, you want to start?
Sure. Currently, we've got it's been busy, I can tell you that. The last couple of months have definitely brought its challenges. With COVID for me, we had to open up a COVID infusion area to administer an antibody drug called bamlanivimab. And I'll ask all of you to say that back to me at some point, just to make sure you pronounce it right. Anyways, this infusion, basically you give to patients early on in their disease process, and the goal is to prevent them from developing severe illness and having to be hospitalized. So we were just given a bunch of this drug from the federal government a couple months ago, and then a huge team got together and really worked hard to get an infusion area kind of set up and up and going. And so being a part of that has been a rush, and just a lot of details to kind of sort out, but very rewarding, to tackle a project like that and see it work out. We've administered 200 doses now to patients, and we're seeing some positive benefit to that. So I get to work every day, and I kind of look at and see what's going on with that area, and then figure out, make sure we have enough staff. And I'm helping kind of scheduling. I'm helping work in that area at times. And then also trying to keep our regular infusion room going, which hasn't really slowed down. We've been pretty busy here over the last couple of months. So, and also part of the vascular access team that I work with, we go throughout the hospital, and we're their starting lines, and they're going into the the COVID unit and starting lines there. It's presented some challenges, that we've had to work through, just work processes, because we also have to go over to the NICU and the PICU and start lines there. So we're doing our best to make sure that we are safe and making sure that we don't get, cross-pollinate anything that we don't want to bring across from one patient area to another. So it's been an interesting time, that's for sure.
Yeah. Ryan or Myrna, an average day? There's an average day.
I don't mind. So yeah, average day is difficult. And it's interesting for those of you who are attending this panel, both Myrna, Jesse, myself, all of us started our career as RNs working direct patient care and taking care of people, and the transition. And I think what you might be able to see here as well with us is the diverse opportunities that nursing has as you progress throughout your career and to different things. My average day as an ER nurse was extremely different than what it looks like right now. Right now, as a chief nursing officer, a normal day is taking care of the nursing practice for all of the CareMC system, and that's inpatient and outpatient, where the clinics are, in surgery. All of the nursing practice everywhere is kind of under my responsibility to make sure it's up and functioning and running well. I'm the incident commander for COVID-19. So you can add in all of the planning and meetings about what we're doing and deciding about visitor restrictions or how are we modifying our services. Right now, the hot button item is vaccinations. So planning how to do vaccinations, what clinics, how we're partnering with the county health department, and then coordinating. Jesse, when we got this drug that he just talked about, this bamlanivimab, maybe that was close, Jesse. Here we had this thing like, hey, here's a new thing that we've never really given before. It has unique challenges because the patients that are getting it are COVID positive. How do you do that? And then being able to work with a team and get the right people in the room to set up that process. I mean, over the last 6 months, it's been very incredible, all the different things that we've had to do. So my day-to-day is a lot of meetings and planning, but it's very aggressively managing a lot of different aspects that I find fairly rewarding.
Yeah, thanks, Ryan. And actually, if you want to stay off mute for just a second, I think that's a great point that each of you are in nursing leadership or nursing education, which is just a few of the directions you can go with an RN. But because a lot of people might start, with that patient care or in an ER, can you give us a quick little summary of what a day in the life of an ER nurse would be like?
Absolutely. A day in the life of an ER nurse. Generally, mornings are fairly slow. So you come in, you don't have a lot of patients in the ER, you kind of start getting settled in and figure out what your assignment is. And then as the day starts progressing, you start getting people that have, whether it's acute stomach pain or other issues, sore legs, orthopedic issues, and then you start getting really sick people in. Then the ambulances will start bringing in, it can be people who are having CPR or really sick or bad trauma. The alert helicopter goes out all over the Northwest Montana, and it can be everything from a grizzly mauling to someone having a heart attack in a cabin in the woods to I mean, really, an ER nurse, it's what you're prepared for is anything on the whole spectrum of something that could be happening to someone, and it could be coming in, and it could be coming in all at once. I mean, some of the crazy days is where you have ambulances coming in nonstop, your waiting room is full of people, the helicopter's going out to get, and you're trying to just treat and stabilize and just move through all those patients coming in. And then on night shift in the ER, it's the reverse. You kind of come in at 7 o'clock at night, and that's when the ER is humming and everything's going on, and you come into this full workload. And then throughout the night, it kind of tapers back as the day goes and kind of gets more quiet in the early hours of the morning. But that's generally what an ER nurse's day looks like.
Wow. Thank you. Myrna, would you like to chat a little bit about your average day?
Well, my average day is working with students to achieve their RN as a nurse educator. And that can be anything from helping out in a classroom to going to meetings to helping people develop curriculum, or sometimes I teach a class, and that's helpful to do that and be part of it and engaged with students. But before I became an educator, I worked in long-term care with geriatric patients. And that's a really rewarding experience, but it's also very, very busy because you have lots of patients and lots of medications to pass, lots of people to be thinking about and trying to make sure that there's having a good quality of life, because as Jesse said, you're at the end of their life when you're working with long-term care patients and the elderly, and not at the beginning. At one time in my career, I taught Lamaze childbirth classes and also worked in long-term care. So people would say, well, how do you put those two things together? And I said, well, I just get you coming and going. So that was how I put those two things together. But I think the point that we're trying to make about our experiences is that we all had different experiences, and our RN license has allowed us to do all these different things. And that's the very incredible thing about being a nurse, is there's so many options, and it's a lifetime career, and you'll always find a job. And it's just a wonderful way to be caring and be part of a really wonderful, compassionate group of people. So yeah, it's a career for a lifetime.
Thanks, Myrna. And I'll keep you there with the next question, Myrna. What is a critical trait or skill needed to be successful in this career? And what, kind of tagging on to that, what makes an ideal professional or student in the RN industry?
So as patients have gotten more ill, and we're seeing really very ill patients in the hospital, and other patients are being cared for in the home environment, I think some of the skills and traits that you have to have as someone who's a nurse is, first of all, you have to have compassion for people. You have to be willing to put yourself on the line. You are the one that's going to take the risk to go in and take care of these people in their worst times when they need the best care. And you need to be flexible. You need to be able to maintain your emotions, and you have to be a critical thinker. You have to be really curious about things. You have to go out and look at what is the most important thing going on with this patient and what should I do next. And you don't just follow doctor's orders. You have to be a solid thinking, educated individual in order to be a nurse and be part of the team.
Thanks. Ryan or Jesse, a critical skill or trait needed to be successful in the career, and what makes an ideal professional or student?
I think that Myrna hit it on the head pretty well with the flexibility. One thing I've seen, in my time as a nurse has just been there's a constant change involved with nursing. It just continues to evolve, transform, adapt. And so you have to kind of have a perspective that change is a good thing, and to look forward to what's coming next with some sort of excitement. You don't stay in one spot. You're always learning more. You're always going to find new skills, new computer programs to work with, and ways to enhance. You're a lifetime learner basically when it comes to nursing. You're committing to finding out best practice for your patients. You're committing to really looking at and evaluating things like Myrna was saying, questioning, even when doctors make orders, or, you are still the nurse responsible for advocating for that patient. And so it's, that's a lot of what's involved. It's just that and just being a positive person, because some people don't have real positive situations you walk into, and they're in a pretty tough spot. They're probably if they're in the hospital, it's obviously a bad day for them. So you are going to get to be the one to kind of still maybe bring a positive light to an otherwise pretty dark situation for them, and you do that by being kind, being friendly, distracting them by asking them about their hobbies, their family, whatever it is. So I think you have to really enjoy being around people and enjoy people to be a nurse. And but also, and like Myrna said, there's also a ton of opportunity. If working the floor is not your thing, you can go into work with a quality team here in the hospital that has that they work with a lot of data, and evaluating outcomes of patients, and finding new processes, and looking at evidence and ways to improve that. So
Nice.
with nursing, you have just a huge doorway.
Great. Ryan?
Yeah, I agree with them to kind of tag off onto that you don't necessarily, it is a people business that we're in. This is healthcare. It's all about people's health. And although not every single nursing role is directly interacting with patients all the time, like Jesse pointed out, if you're in the quality department, you're looking at, quality measures and how we can do things better, and statistics and data about, outcomes of patients. But the one thing that's absolutely true, no matter where you are, if you are an RN, patients are at the center of everything you do. And it's about patient advocacy and what's best for the patient. Myself in the nursing practice here, it's about how do we make sure that everyone is taking care of those patients correctly. Same thing with Jesse. Even Myrna at the college, which you think, okay, is maybe one step removed from patient care, but it's really not. Their students are in amongst our patients, and they're instilling in the new and the next generations of nurses that understanding that our business is patient advocacy. That's the core of our business, is taking care of patients. And I think that it's important for everyone to remember that is one of the key traits. If you come into nursing, your goal has to be advancing the health and well-being of other people. That's what your goal needs to be.
Well said. So next is two parts. Let's just say, what is the most challenging thing about the job? It's probably a lot of challenges, but if you can choose one, and it can't be the pandemic. And then the second one is, what was the most challenging thing for you in training or education? Jesse, you want to start?
Sure. I think the most challenging thing, and also one of the best things about nursing, is just the amount there is to learn. You're always going to get to learn something new. Starting out as a new nurse, I just remember the feeling of like how much I didn't know, like hanging over my head. Like, when you hit the floor still, I mean, the programs you go through are phenomenal, but the real life experience really sets the pace for realizing that you're on a kind of a lifelong journey of learning, and you just got to take it one step at a time. And just kind of, I think one of the toughest parts is, the worry of making a mistake, because your goal is a positive outcome for that patient, and you definitely don't want to be a reason that they don't have that. So sometimes you carry that on your shoulders when you're, indirect patient care, especially, that's an issue. But even in leadership, you're then responsible for the teams, and you're trying to do your best to make sure that they don't make mistakes that may negatively impact patients. And we do, and that's why we have quality departments, and we have a lot of processes in place to try to avoid any kind of error that may affect the patient. So that's kind of, I think, the heaviest part of this job sometimes.
And do you have a challenge from training that you remember or that you can think of?
From a new nurse perspective, I would say understanding there's a lot of new terms, just workflow processes that I didn't quite understand yet. I came from a tire shop into nursing, so like this was a big change for me. Like I understood how to change brakes and shocks, and to go in there and figure out how to manage an NG tube, it was just a different setup, than what I was used to. So that was the biggest challenge for me. It was just the complete change, but it worked out, I can tell you, in the end, and I'm still really glad I'm not in the tire shop.
Great, thanks. Ryan, do you want to go? most challenging aspect of your career and then your training.
Sure. So the challenging aspect of my career, you know, as we say, this is a people business, and you're going to be around people at their worst times and families who are going through very difficult times and challenging, heartbreaking times. And I think it's hard to protect yourself emotionally and try and give the support and empathy to them as they need. And sometimes you're around people where they don't really understand what's going on, or they're having so much emotion from what's going on in their life that they're not kind of acting how they normally would. So it is a challenge when you're dealing with scary, uncertain times with people and their families, and you know, trying to interact with them and yet still be able to continue on. No matter what this patient is happening in this room right now, you've got other patients that need you that have varying different needs, and you've got to be able to kind of transition from each circumstance to the next, provide those patients with the care that they need, and kind of compartmentalize that out. And I think every nurse over the course of their career kind of finds the way that they process and handle those emotions that come up through nursing, and how to, you know, basically continue to go on and basically like live their normal lives, while the fact that our careers are basically based around a super highly emotionally charged environment and interacting with people. So that's challenging.
Yeah, and then do you have one for training?
Yeah, so in training, I think the biggest key is that once you're in and you get prepped and you're into RN school, you need to be all in for it for the course of it. It's not slow. It's not, you know, measured out. I mean, you need to be prepared to study hard, to stay committed to it. It's not one that you can kind of put yourself in a neutral and guide through. You really just got to be committed to that program and process, and it's definitely not an easy. I don't want to say it's too difficult. I want to set the bar hard for people who the bar high for people who are looking into it. But it's something that you got to prepare for and go through. It's challenging.
Great, thanks. And Myrna?
So from my perspective, I think the most challenging thing is, you know, what Ryan and Jesse were talking about, is you do have to find boundaries. You do have to be compassionate and caring without taking on people's situations and taking things that people say to you personally. And you need to learn to be able to demonstrate that you care about them without personally getting involved. Or if someone swears at you or calls you names or yells at you or whatever, you know that you can't take that personally, that that's just what's happening with that patient during that time. And you just have to step away and recognize that. And so that's one of the things we try to teach students in the program, is that, you know, you have to, and making mistakes is okay. The most important thing to do is to take responsibility and be accountable for those mistakes. I think sometimes that's really challenging for people. And asking questions, please, please, please ask lots and lots and lots of questions, because that's how you'll learn. What the education does is give you enough knowledge to just get you started, and the rest of the learning takes place as you get out into the workplace. And so I think that's, for most people, is the most challenging thing in getting into nursing education, and learning how to be curious and be a detective and search and look and be willing to learn.
Great, thank you. And I'm going to keep us moving a little bit. So it's 9:26. So two things. If anyone who is an attendee wants to submit a question, you can go ahead and use the Q&A feature to submit a question, and then we'll make that kind of our last couple minutes. I do have two more questions that I'm excited to get to. So if it's okay if we kind of zoom through them a little bit with our panelists if we don't hear from anyone. The first one is, well, I'm just going to tell you, the last one is like, what would you tell a high school student interested in this career? I just want to throw out really quickly, if anyone has like the best career decision you've ever made, we don't have to go through all three panelists, but if you just have something that's like, here's this thing I did in my career and I would definitely want to tell people about this. Does anyone have one of those to share, or shall we move on to the last question?
I think becoming a nurse educator was one of the best career decisions I ever made.
Awesome. Any other best ever?
Well, I think I think my answer answers both questions, and that was to become a nurse. I mean, of all the things that I did, to spend a lot of years as a captain, fireman, I own a construction company, all that stuff. When I, talking with Myrna and a few things years ago, getting prepared, the best thing I ever did for my career in my life was to go to nursing school, get engaged in this process. It's completely transformed what I can do and how I provide for my family. And that's what I'd say to a high school student. I suspect that no one regrets their RN license.
Wow. Thanks, Ryan. Jesse, do you want to take the best career decision you ever made, or you can?
I'm just gonna second that. Yeah, like I remember the moment when a friend of mine was like, "You should try nursing school." I was enrolled in, to become a physical therapist, and I was like, and it just right there, I said, I'm gonna try that, and right there, it kind of set in motion a lot of stuff, and really, really grateful that this is the course I'm on.
Great, thank you. And then just before we close out, we did get one question. What are some of the differences between an RN and a DNP? If anyone wants to kind of mention that.
So the initial degree that you get or initial license that you get is a registered nursing license, and there's many ways to do that. Well, there's a couple of ways, but you can do the FECC program, and that's about a 2.5 year process to become a registered nurse, and you take the same licensing exam as someone like Jesse did, who went through a bachelor's program through Montana State University. On the East Coast, they have what are called diploma programs, which are about 3-year programs, but they all basically teach the same thing. And in order to get to a higher degree, you have to start somewhere. You have to get your bachelor's degree, and you can take the associate and move it into a bachelor's. And then, as Ryan has done, he's moved that associate into a bachelor's degree, and I believe you've moved that onto your master's. And then in nursing, you can get a doctorate. And so there's a PhD in nursing, which is a research degree, and then there's a Doctor of Nursing Practice, which is more a practice degree, and that's nurse practitioners, and that level of individual is what a DNP is.
Thanks, Myrna. And then I'll just keep you there. Anything you would want to tell a high school student who's interested in this career to do now, and then we'll just close out with that final question we're up against.
What I tell them all is please take your math and your sciences because you are going to need them all when you get into nursing. And yes, you do have to do math, and yes, you do have to do science, and take all those classes in high school so you're prepared.
Great, thank you. Any final closing thoughts before we go ahead and say goodbye? Okay, we'll close out then. Thanks so much for joining us today for the attendees, and also thanks to our panelists. You guys are busy people, so thanks for taking the time to chat with everyone.
Well, thanks for having us. This was really great.
Yep,
Yeah,
have a great
anytime.
day.
Bye, everybody.
Thanks, Allison.
Yeah,
Bye,
thank
Myrna,
you.
Jesse.
Bye.
Yeah. Bye, guys.